My top medical concern is ensuring that people with pre-existing conditions like me still have access to health care, regardless of what politician wants to do away with the Affordable Care Act. What's at stake for people with disabilities in the 2020 election is that it's the difference between life and death for us.
Cost or availability of healthcare. I think there's a lot of obstacles between people and their healthcare right now that we need to fix.
Definitely affordability and access for everyone. How much is something going to be when I go to my doctor's office, or if I have a family member in the hospital, like how much is that going to cost me?
You can almost go into debt for being sick.
We love to believe that, because doctors are educated, or, the hospital is a place where you encounter educated people, that no one sees race and no one sees color. But that's simply not true. As a Black woman, I've had many racist encounters in the hospital.
What is going on with the system? As we know, it was created a long time ago and it's rigged against a lot of different populations, people of color, LGBT people, people with disabilities. I think it's time for us to take a look at it and make it more equitable.
It's about equity. It's about making sure that people in rural areas, people with low incomes, people with pre-existing conditions all have the same access.
When I go into my transplant hospital, even to the emergency room, I am treated like a drug addict, not an educated professional woman who started her own nonprofit at 19 years old, not a woman that worked in the Obama White House in the Office of Public Engagement and Intergovernmental Affairs. I'm treated like a dope fiend who wants pain medication to get off. I have to show the world that I'm valuable enough to be kept alive.
I hear, let's do away with Obamacare, but nobody has said what would replace Obamacare. Would the pre-existing conditions survive whatever new healthcare initiative they create? And I think that's very concerning to me, because there are many people that wouldn't have health care because of pre-existing conditions.
I want the ACA to be supported and everybody to have coverage and to have access, easy access at a good cost or reasonable cost to a primary care physician.
It's been a long-standing practice of this country to take care of people, and I think it's kind of crazy because people from the past have been able to come into this country and get those benefits or what they need to tie them over until they can get what they need to have done straight. And now all of a sudden we want to make it a prerequisite that if they can only come as long as they're not going to get any services, and I don't think that's fair.
I believe healthcare should be a right, not a privilege, because we require it to live, and I don't think we should be denying it to people just because they aren't legalized citizens yet. I especially don't think that people should endanger their livelihoods to get healthcare. I think they should be reconcilable. And so the public charge rule that the administration has put on immigrants is a big concern of mine, as well as just generally healthcare in this country.
One of my biggest concerns is expanding Medicaid.
So I make too much money for Medicaid, and I do not make enough money to be able to afford insurance on the exchange. So I'm stuck in the middle between these two places. And I'm afraid I'm going to die because I don't have a way to go get my heart checked out.
Right now, a lot of people don't know that Missouri has one of the lowest Medicaid eligibility levels in the nation. For a family of 3 to qualify for the parents to have health insurance through Medicaid, they can't make more than $400 a month. That's a really low income, and it means that a lot of people are shut out of health insurance.
Missouri chose not to expand. Missouri chose not to take the Obamacare funds that we lost to other states because of the word Obama was on the ACA, and they decided that they wasn't going to take it. And I think the state of Missouri probably lost about $90 million that possibly went to other states.
What if my health insurance stopped covering one of the medications I need to live? And as a transplant patient, you take medication until the day you die. I don't care what you see in the Disney movies, Hallmark movies, or on TV. Once you have a heart and kidney transplant, you are not healthy and it doesn't magically make you well again. You're constantly in and out the hospital, test after test. I wasn't supposed to live to see past 20, and I'm 29 right now. That's what's at stake.